Ever wondered what causes plantar callosity? Well, let's dive right into it. Plantar callosity, often known as a callus, is a common foot condition, yet it's frequently overlooked. This condition is characterized by the formation of thick, hardened layers of skin on the sole of the foot, particularly in areas of repeated friction or pressure. Think about it. Our feet are the foundation of our body, bearing the brunt of our daily activities, whether it's running, walking, or even standing. It's no wonder then that they sometimes develop these protective layers, or calluses, as a response to this constant pressure and friction. However, while calluses might seem like a minor inconvenience, they can lead to more serious issues if not addressed properly. And the first step to addressing them, that's right, understanding what causes them in the first place. Understanding the cause of plantar callosity starts with knowing its pathophysiology. So let's move on to that next. So what exactly causes these toughened areas on your feet? You might be wondering. Well, it's all down to the pathophysiology of plantar callosity. Let's break it down. Pathophysiology is simply the study of how disease processes affect the body. In this case, we're looking at how the body reacts to certain pressures and frictions, leading to the formation of plantar callosities, or what are commonly known as calluses on the soles of our feet. The outermost layer of our skin, the stratum corneum, plays a key role here. This layer, which is naturally thicker on the palms of our hands and the soles of our feet, is our body's first line of defense against the outside world. It's designed to protect our body from damage and infection. Now imagine your feet. They bear the weight of your entire body, day in and day out. That's a lot of pressure. Add to this the friction caused by walking, running, or even just wearing tight shoes, and you've got the perfect recipe for plantar callosity. Here's what happens. The consistent pressure and friction on the skin of your feet sends signals to your body that it needs to toughen up, literally. In response, your body starts to produce more and more skin cells in the stratum corneum. These extra cells pile up and harden, forming a protective barrier. This barrier is what we call a callus. But it's not just about pressure and friction. Other factors can also contribute to the development of plantar callosity. For example, structural foot deformities, such as bunions or hammer toes, can increase pressure on certain areas of the foot. Similarly, certain types of footwear, such as high heels or shoes that don't fit properly, can cause excessive friction. So, in a nutshell, plantar callosity is your body's response to repeated pressure and friction. It's a protective mechanism, albeit one that can sometimes cause discomfort and pain. Now that you know what causes plantar callosity, let's delve into how it presents itself. Wondering how to identify plantar callosity? Well, the most common signs are often right under your feet, literally. Let's delve into these symptoms. The first thing you might notice is a hardened, thick area of skin on the bottom of your foot. This is the body's natural response to repeated pressure and friction. It's your body trying to protect itself, but it can cause discomfort. Now, this hardened skin might be painless at first, but over time you may start to feel tenderness or even pain when you stand or walk. This is because the thick skin can put pressure on the underlying tissues, and if the skin becomes very thick or forms a sharp core, it can be particularly painful. Sometimes the skin may also become flaky or waxy, and in severe cases, you might even notice some yellow or red discoloration. Recognizing plantar callosity is the first step in management. So keep an eye out for these signs and take action if you spot them. What can you do if you have plantar callosity? Well, there are several management options available. Let's dive into them. First and foremost, the goal is to reduce friction and pressure on your foot. This can be done by wearing comfortable, well-fitted shoes. Avoid high heels and tight shoes, which can increase the pressure on your feet. Next, consider using protective pads or insoles. These can help redistribute pressure away from the callus. There are various types of pads available, including foam, felt, or gel pads. Each has its own benefits, so it's important to choose one that suits your needs and comfort levels. In some cases, a foot care professional might recommend a procedure to remove the callus. This is typically done if the callus is causing significant discomfort or pain. But here's a crucial piece of advice. Always consult with a healthcare professional before starting any treatment. They can provide a proper diagnosis and guide you in the right direction. Remember, it's always best to seek professional advice for proper diagnosis and treatment. In conclusion, Plantar callosity is a common condition that can be managed effectively with the right knowledge. Throughout this discussion, we've understood what it is, explored its pathophysiology, and seen how it presents itself. We've also delved into various management options, giving you a comprehensive understanding of this ailment. This knowledge empowers us to handle plantar callosity effectively, enhancing our overall foot health. Thank you for watching. If you found this video helpful, please subscribe to our channel for more informative content like this.